Hello, I'm Dr. Jason Lowry. I focus on hip and knee replacements primarily. And in the hip and knee replacement, I do focus on what's called an anterior approach hip replacement, which means in the front of the hip. The traditional technique of hip replacements was either an incision on the side or the back of the hip. Patients in general do very well, and extremely well, in fact, with hip replacements. However, one of the nuances of doing the surgery from the front of the hip is a quicker recovery because we go through a natural muscle interval that's actually in front of the hip here. And so what I have here is a model of a hip replacement. And when we do a hip replacement, what we do is replace the head ball, which is part of the ball and socket of the hip joint. We replace that with a stem that's actually inside the thigh bone, and attached to the top of that stem, there's a head ball. And then on the socket side, we remove the arthritis and replace the socket with an actual metal cup. And the head ball fits nicely inside the hip replacement as this model is showing. So if you're having hip problems, come see me at our Arlington, Mansfield, or Midlothian locations.